Namaste, welcome back to our channel Ayurveda 360. Moving ahead with the induction series, which focuses mainly the BMS freshers who have just joined the course. Also, it is applicable for even other BMS students, irrespective of the professional year what they are studying. So, in this session, we are going to see certain common mistakes students do when they join BMS. Since the students are not aware of the happenings in the professional college or professional life, certain mistakes are bound to happen and that may have a long lasting impact on them. So watch this video till the end, specifically if you are a fresher, and then try to avoid this so that you will have a fruitful professional course ahead. So, as you know, we are already in the fourth session of the induction program. There are other videos which are already uploaded, first, second, third. If you have not seen that, kindly watch them and even watch the future videos. In this session, we are going to see the common mistakes. So, in the first year BMS or first professional BMS, as per the new NCISM guidelines, the syllabus is consisting of 5 subjects. As you already are aware of this, we will not discuss in detail. Now, the first thing what the students will have in their mind is which book to read. So, this is a very common question even the teachers are going to get from each of their student. Now, books for these subjects are very critical. One thing you need to remember is when you enter a professional course, there is nothing called as a textbook. Everything is you can say, reference book. There is a difference between reference book and textbook. Textbook, or you can say based on curriculum, whatever book is written, it's a compiled notes like book which doesn't give a deeper insight of a particular subject. It could be any subject. Whereas reference book means it is having the opportunity to explore the topic in depth, which means the size of the book. When I compare, reference book will be of course bigger and it could be in multiple volumes. Whereas the compiled textbook could be very small or it could be medium sized with limited number of pages. Now the students here fall for the trap. Fall for this trap. They usually go with the textbook, or you can say compiled small book. The smallest book is the bestseller, which is, you can say, considered in today's time. If you observe, most of the students are making this mistake, more than 90%, taking the smallest of the book available in the market so that it can be completed fast and written in the examination. It is not so. The scenario will not match your thinking because you are here for a professional course rather than getting the grades. So till 10 plus 1 plus 2 it is fine, where marks are considered to be superior for higher studies and other things, for other gradations. But when you enter into a professional course, irrespective of your marks, the thing that should be kept in mind is regarding your practical approach in that particular subject. Now you are in the medical course, your medical professional, you can say the knowledge should be superior when you compare it with, or you can say at least on par with the colleagues of your time. Otherwise, you will be a failure in the professional life. So I wouldn't suggest any particular name for a particular subject when you ask me the name of the book, because the intellectual capacity of each student varies, the need varies. For example, in the exam time I may tell other author, during the preparation time, or you can say while I'm studying for knowledge, the book may be different. So it is not possible to pinpoint one particular book as the best. As per the situation, as per the student, as per the, you can say, guidance given by the teacher concerned, the textbook, or you can say the book which should be referred, varies. So my sincere advice would be, don't purchase any book in a hurry. Usually what happens, certain of the seniors may suggest you books, certain teachers may suggest you books, certain sellers, book sellers, publications, they may sell you book. Certain colleges take extra money and they themselves give the book. This is 100% scam. I call it as 100% scam because usually the colleges which give books on their own by taking money from the students, they are having a very huge discount from the distributor, or you can say publication unit. That's why they are purchasing and give it to the students. So this is very wrong practice. Of course, if it is wrong, you have to tell it as wrong. Whether it is on record or whether it is off the record, it is wrong. So don't fall for all this trap. Even if you have joined such a college where books are already provided, and if you feel they are not so good, definitely don't continue reading that book. Go to library. Initial 15 days, see each and every author who has written a book book on that particular subject. Within a span of 2 or 3 weeks, definitely you will be convinced that this particular book is good for me. So again, it varies from person to person. That's why I am telling it's a generalized topic. It cannot be pinpointed. Just because I write a book, I cannot force you to tell that my book is the best. It is not possible. So this is one important aspect. So of course, many of my colleagues or some authors who have already written the book may not agree with me. They may dislike this video and other things. But definitely whatever I am telling, that is truth. Next, in relation to following. So many of the seniors will be eyeing on juniors, and certain people will have a negative impact. So don't blindly follow each and every guideline given by your respective seniors. So why is that so? Because each and every person who has joined the professional course may not end up with the same line of practice. For example, you are in 10th, now you have to enter +1. So everybody enters into +1, there is no doubt about that. But after BMS, it doesn't mean everybody practices. After BMS, it doesn't mean everybody goes for post-graduation. It doesn't mean after BMS, everybody is going into pharmaceutical field. It doesn't mean that all BMS graduates will practice Ayurveda. It doesn't mean that all Ayurveda graduates will enter into medical field. Certain students simply enter the course just because they are forced, or they simply enter because they have a huge amount of money already at home. Parents don't want them to be without degree. That's why they send with huge amount as a can say donation to the college. Now, when you follow such kind of seniors, definitely you are going in the wrong direction. Now, analyze those seniors who are having good, you can say, balance between professional life, personal life, and you can say the social life. So whomever you feel will have a similar vision like you, can follow them. Otherwise, don't follow everything. Just listen. It doesn't mean you have to quarrel or something, or it doesn't mean you have to just argue with them. It doesn't mean like that. Listen to them. Following or not following is in your hands. Now, similarly, in the same batch, in your own batch, there will be many friends. And again, finding the right friends group. I am not telling that you should make a friends group and create groupism. It is not so. What I am telling is, whenever you take a decision, don't get influenced by everyone in the class. So again, find that particular similar vision friends. So if you have anything in mind about a particular goal, discuss with them or take their opinion. Otherwise, don't take each and every person's opinion. That is another important aspect. Now, since you are in BMS, you have to study Sanskrit, and I have given certain videos about the basics of Sanskrit, and will be giving in future as well. And of course, we'll be having detailed classes in your respective colleges. So giving few minutes to Sanskrit every day is very much important, because it's not taught since, you can say, from the lower kindergarten or +1 and up to +2. So it means that you have to give certain time for understanding the grammar and the vocabulary of Sanskrit. What I mean here is the improving the vocabulary of Sanskrit. Now, most of the students see postgraduate seniors and other, you can say, higher studies students, scholars, and they feel like they have to study too much to get into post-graduation and other higher studies. At the same time, they compromise on their professional life, which means they don't enter into hospital, they don't see the patients, they just are aware about notes written or information written in the book. So they will be simply called as bookworms, or they will be simply called as nerds without having practical knowledge. So don't fall into that category. Following the professionalism, you can say, visiting the hospital, taking the history, developing the rapport with the patient. So that is very much important. Now, whenever student enters into professional life, especially the medicine, so they don't give equal importance to their co-curricular activities and other routine schedules. they are almost stressed out about their studies. It doesn't happen like that, or it doesn't work like that. You have to balance each and everything based on a particular routine. Don't give up your co-curricular activities. Sports, co-curricular activities, whatever you are best since your childhood, keep them along with the studies, then only you'll be able to manage. Otherwise, simply studying 5 to 6 hours a day doesn't work. Now, when you start studying, initially you may feel certain subjects as favorite. So don't just read that particular subject. You have to balance each and every subject. So that is very important. Give equal opportunity for the subjects so that you understand each and every subject in the beginning, so that the base is very strong. The base itself will make you understand the further subjects in the coming years. So otherwise, what happens is, if you are interested in imagine anatomy, you just are aware of anatomy. Otherwise, Ashtanga Hridayam, Charaka Samhita, and those subjects you may even fail. So it doesn't work like that. You have to balance each and every subject. Whenever you have a query in your mind, irrespective of how small or how big it is in terms of the magnitude, very silly or very serious question, you have to discuss with the faculty, respective faculty, or any of the faculty whom you feel can convince you. So this is one advantage of professional life. You need not depend on only one staff. There will be huge amount of faculty. You can ask anyone. Each and every person will have one or the other inputs which can help you. So getting cleared is very much important. The more you ask, the more clarity you get, and that is the rule of, you can say, any college or school. Next, when you enter into BMS, learning a shloka is a mandatory process. Certain shloka are compulsory, especially for examination purpose, and some are definitely for clinical practice. So students learn this shloka without understanding the meaning, just for clearing the exam. Again, the wrong influence of the faculty or the seniors or the batchmates. So not understanding the shloka, and if you know the shloka, I call it as thin. It doesn't make any sense. It doesn't have any value. You have to understand, then only you have to learn the shloka, or you can say the knowing of shloka will have certain weightage. In the one of the videos, you will be understanding how to memorize the shloka. In the next session, you can see that in detail, how to memorize. Now, this is one mistake which I can say not directly as a mistake of student. It could be of the parents as well. Certain times the forceful admission to courses like this will create certain negative impact on the student. But the thing is, the student is on the negative side. He is not at all into professional life, but at the same time, he is not ready to leave the course. Now what happens after 5.5 years? Nothing is going to happen. He just wasted, or she just wasted 5.5 to 6 years. If he or she fails 1 or 2 times, it may go even up to 7 to 8 years. So there is no point of you being in the course, not only BMS, any course, if you are not interested in either way, in subject, or it could be in professional life. In both the ways, if you are not interested in the science, definitely discuss with the parents. Initial days, you have the opportunity to revert back, you can say take back, and do something what makes you feel with good passion. So leaving the course is not an issue. Discuss with the parents, not just for BMS, I'm talking in general. Professional life is your lifelong life. You can say lifelong, you can say the activity. If you choose it wrong, if you choose it not of your interest or not of your taste, then definitely you are going to suffer. So that is very much important. It requires, again, you can say the guts by the student to discuss. Of course, it is necessary. If you are having, definitely discuss, or at least inform certain faculty so that they can discuss with the parents. Now, after taking admission, usually students will have a lot of thoughts in their mind, like I'll be giving next year one more time entrance exam and other things. Of course, it comes and goes every now and then, but if you are not getting interest in the subject what you have taken, even after 2 or 3 months, it means somewhere or the other there is some issue. It could be from the faculty side, or it could be from your own side. So once you have entered, make sure you get, or you can say take the interest in that particular subject or science within 2 to 3 months. Otherwise, if you start preparing for other exams during that time, keeping in mind, like, even if I don't get that course, next exam, even if I don't clear, I already have this course. It doesn't work like that. So at the maximum, before joining, you can take a decision whether to take exam again or not. Otherwise, once you enter, it is almost difficult. Maybe 1 or 2 students may clear next year and take their own choice, but all the students may not be able to clear this. So this is also one of the common mistake. Now, it's a mistake or not, again, depends on your you can say confidence or your work ethics. So if you're sure, then definitely, like if you're sure of what you're doing, then definitely you will be on the positive side. If you are doing mistake without having the actual idea about your own abilities, then definitely you will be on the negative side. So these are certain of the mistakes, major mistakes. Of course, there are many things which can be discussed, but certain major points I have highlighted so that initial days, if you are aware of this, you will make the least mistakes. I hope in that way. That's why I made this video. Otherwise, it's a generalized one. Of course, 100% of it is from my perspective. There could be some changes percentage wise from person to person. So I respect that some people may have different opinion, but definitely these are the ones which I have seen in my life through certain of the friends and other students. So that's why I wanted to put this forward, and certain of you also requested me to make a video of these certain mistakes, common mistakes, so that you will be alert in the initial years. That is very much important. Once you are not making any mistake in the first year, it is almost sure that you are not going to make in the near future, because you have your own decisions. You are not influenced by the, you can say, by the bad groups. So that's why your decision will be right, and always it will have a long lasting positive effect. So the takeaway point is, whatever happens, positive or negative in your professional life, you cannot blame it on anybody else. Even if your friend has made you to lose certain of BMS career, still the reason will be you. That is why you is the, or you can say you in inverted comma, is the important word here. Positive also you, negative also you. So your decision, your confidence matters. So with this, we complete this common mistakes during BMS video, especially from the beginner's point of view. Similarly, we'll be having the continuous discussion regarding certain common problems and other, even the basics of Ayurveda in this series, induction series. At the same time, we also have certain other playlist where we'll be seeing direct subject related matter or even general matter. So kindly go through that. Kindly like, share and subscribe to our channel. Kindly let your other Ayurveda friends to know about our channel. Until next time, thank you.